Okay, so I'll go ahead and get us started. Welcome to another week of the CSDE seminar series. This week we've created a panel that's focusing on the social and economic impacts of COVID-19. We're very grateful for Marissa Baker, Rachel File, and Chelsea Rose, who have agreed to give a talk on their research on this issue. We're going to have each speaker talk for 12 to 15 minutes. And then in the end, we're going to do a Q&A with all of the panelists to talk about their research. So just a reminder that if you have questions for the speakers, to please put it in the Q&A chat box. If you have a question that's targeted towards a particular panelist, please mention their name whenever you're asking your question. Otherwise, we're going to assume that the question is for everyone on the panel, and we'll give an opportunity for everyone on the panel to give an answer. So just to be short on introductions and long on discussion, I'm going to first introduce Marissa Baker, who's an assistant professor at the Department of Environmental and Occupational Health Sciences, who is going to give her talk on experiences, needs, and risk perceptions of app-based drivers during the COVID-19 pandemic.
All right, hello, thank you. So I want to acknowledge my co-authors on this work. I see that one of them at least is on this call. So Carrie Beckman, Lily Muncy, Megan Archer, Ann Bostrom, who is here, and Nicole Arrett, all were fundamental in exploring the experiences of app-based drivers during COVID-19. So app-based drivers, what I mean by that is Lyft drivers, Uber drivers. We know that these are drivers who lack most all workplace protections because they aren't considered employers of Lyft or Uber. They are considered independent contractors. This has historically been a very hard to reach population, often because of immigrant status of the drivers, and because they don't congregate in workplaces or in one central location like many workers do. Also, it can be hard to define, who is an active driver who is driving as their sole source of income, and who might be a more passive driver who is picking up some rides now and again when necessary. So particularly during the pandemic, app-based drivers were a group that was very much at risk. Very early in the pandemic, there was, a lack of demand for services, particularly as things were shutting down and folks were no longer traveling to and from the airport. Also, when public facilities like libraries or community centers shut down, there was a lack of safe places for drivers to stop to do things like go to the bathroom or fill up their water bottles, which really made it more challenging for them to move around. Of course, these drivers that are at a high risk of exposure due to, having close contacts with other humans in a fairly confined space and perhaps having multiple humans at a time. If you don't drive, you don't get paid, which forced often choices between driving in a perceived unsafe vehicle or, not having enough money for your family. And also because of they lack employee protections, they often have limited access to sick leave, healthcare, and unemployment benefits. Later into the pandemic, and even now, as folks are moving around a little more normally, there's concerns of the drivers, not only all the things that I already mentioned, but also having to enforce PPE for passengers and maybe lacking PPE for themselves or even knowing how to best protect themselves. And this is a quote from one of the drivers who participated in our study, who said, "And then every person in your vehicle, you have to sanitize your vehicle. And then we buy all those equipment. So that's the thing and my issue personally. But for now, I just continue buying from my own pocket. So, bearing the cost of keeping themselves safe at work. For this survey, we were honored and excited to collaborate with Teamsters 117. So our app-based drivers out here in Seattle are unionized, which is amazing and incredible, and has really led to a lot of benefits for these drivers. Another quote from our survey is, "The unity we want motivated us to show support for our fellow drivers. Then they know if we are united, we can achieve a lot. We would be looking after each other." And this is why employers don't want people to unionize, because it really is true that once you get folks motivated to look out for each other, workers really can achieve a lot. So the way our survey worked is we developed a survey, and I'll go into a little more detail about what was in that. And we actually worked with 4 driver liaisons who are part of the union. And some of them, they're represented in these pictures. And those 4 drivers, the study team trained them in delivering the survey, and they did the survey over the phone to their fellow drivers, which was great because they could translate it in real time. It created a sense of trust between the drivers who were taking the survey and knowing who's administering it. And I think we got better data because of that. So as I said, our survey utilized these 4 peer liaisons, which I consider to be a strength of this study. And we reached 100 drivers in less than 1 month, and that was our goal to get 100 drivers. The 10-minute survey covered stress, job satisfaction, COVID-19 infection status, concerns around exposure and infection, sources of trust, and access they had to health protective, not only behaviors, but controls. We also had a qualitative aim of this survey, or of this study, and we completed 8 qualitative interviews with drivers and union representatives. They were asked about access to controls, needs, and barriers and facilitators in accessing controls. And the quotes that you have seen so far have come from those qualitative interviews. So the results of our study, just some of the demographics, 84%, I'm sorry, that's supposed to say 84% of our respondents identified as Black or African, and the majority were in the age range of 35 to 54, and mostly all males. At the time of the survey, 42% of the respondents weren't working at all, but prior to the pandemic, all of them had been working. In fact, 87% of them had been working more than 40 hours a week before the pandemic. So these are drivers who, this is their job, this is their sole source of income, not just weekend or as needed drivers. We also found that this was a highly stressed population. We used the perceived stress scale, the 4-question version. And we found that our drivers had a mean score of 9.2. The range for this scale is 0 to 16. So 9.2 was much higher than the general population and other workers at this time. Also of note, 30% of our respondents thought that they had had COVID-19. And we were only able to ask as, do you think that you might have had it? At the time of this survey, testing was still fairly inaccessible. This was done in September of 2020. So testing was fairly inaccessible, and many in this population would not have been able to seek testing even if they had wanted to have a test. In our job satisfaction questions, only 2% or 2 of the respondents reported being paid a fair wage and that their pay had kept up with the cost of living. However, the majority of workers reported that they like their work and that they're proud of their work, and they know that their work is appreciated by the community. So these workers are doing work that they find fulfilling and important and take pride in, and they are not being compensated even a fair living wage. Drivers were highly concerned about exposure and infection. we asked a series of 5 exposure questions, asking drivers to rate how they were concerned about things like being exposed to COVID-19, exposing their families to COVID-19. And we also asked about concerns around infections, such as, if I'm infected, I won't be able to drive. If I'm infected, I won't be able to take care of my family. And across the board, almost every single driver rated that they were very concerned about all of those scenarios. So there was a real concern not only about exposure in their vehicle, but also the effects that infection would have on not only their jobs, but also their families. When we asked about sources of trust, drivers trust scientists, they trust their own knowledge, and more than half say they trust the government. However, very few drivers said that they trust their passengers to keep them safe, or the company they drive for to keep them safe. And that's confirmed when we saw that only 31% of drivers reported receiving masks from the company they work for, which does not go far in keeping people in building trust among the drivers. Here is results from a regression where we looked at determinants of stress in these drivers. And so our outcome variable here is stress, that perceived stress score that I mentioned earlier. And what we can see from here is that in our model where we controlled for age, years driving, the current hours that they were driving, and the change in hours that they were driving from before the pandemic, the 2 variables that were related to stress was job satisfaction and having a positive COVID-19 diagnosis. And so we found that, as job satisfaction decreased, stress increased. And similarly, among individuals who thought they had a positive COVID-19 test, their stress increased by about 2 points. And looking at it graphically, you can see along the y-axis there is COVID-19 status. The x-axis is the mean stress score, and we can see that indeed stress was elevated in those who believed that they had had COVID-19. So just to end, I want to touch on the impact that our survey has had. Results from the survey were used by Seattle City Council in passing kind of an update to their fair share plan. Specifically, that update had a provision to provide a weekly allowance for drivers to buy PPE. And this was because we saw that drivers were not receiving this PPE from their the company that they drive for. This update also gave workers paid time to clean their vehicles. Again, we saw that drivers were spending money on cleaning supplies and were very concerned about the cleanliness of their vehicles during the pandemic. And so, the results of our survey were able to help in getting those drivers compensated for the time they spent cleaning their vehicles. We published this work in the American Journal of Industrial Medicine, and it actually got picked up by the national media. It was covered in TechCrunch this weekend. So nice that it's reaching a new audience. But probably the most important impact from this is the continuing relationship that the study team has developed with Teamsters 117. Being able to continue to work with them on ongoing projects. They're interested in working to, characterize the experiences of women drivers. And so that's something that I'm excited to be working with them on. And also up top, I completely forgot to acknowledge the UW Population Health Initiative, who funded this work. So they have been really instrumental as well in fostering the relationship with Teamsters by ensuring that we have money to pay them to help with the survey. So thank you. That's the conclusion of my presentation.
Thank you, Marissa. So next we're going to have Rachel Feil, who's an associate professor at the Evans School, present on her research called Compounding Challenges and Policy Innovations in Housing and Shelter During the COVID-19 Pandemic.
Thank you. Um, nice to see us. I had the list up, now I can't see the list, but nice to see there. I also have some collaborators in the room. I'll do a shout out in a moment here. I want to just start by saying that I'm giving a little bit of an unconventional research talk here. I had the privilege to be a member of 2 different research teams receiving COVID-related grants from the Population Health Initiative. And instead of giving a detailed research presentation on either one, I'm going to give kind of a high-level overview of both and also talk about just in general in the sphere of housing and homelessness, how the COVID-19 pandemic compounded the existing challenges and motivated some policy innovations. So first, I just want to take a step back and think about the unique spotlight on housing that the COVID-19 pandemic really created. So we have these pandemic directives, social distancing, stay-at-home orders, self-isolate, which I looked into it. I'm not quite sure how that's different than isolating, but this is the language that we use, self-quarantine. And these are all terms that are now very common that, 2 years ago, I think many of us never would have heard of. But baked into all of these directives is an assumption or a requirement that folks have a safe place to live, have the autonomy to come and go and stay as needed, that if you need to stay home, you have a safe place to do that. And also that within your residence, you have enough space to physically separate from others who share your residence. So very quickly, we see what I think the general population maybe heard or learned as directives for how to respond to the risks within this pandemic have some pretty unique implications for folks who are experiencing homelessness or who are precariously housed. So we have some opportunities here to think about housing in particular. So the first study I'll focus on a bit is the impact of hotels as non-congregate shelters, non-congregate emergency shelters. Research team led by rockstar Greg Colburn, also a CSDE affiliate, some funding from PHI as well as Urban at UW and the Gates Foundation. We drew with our partners at King County and the evaluation team from the Department of Community and Human Services. We drew on administrative data and then combined that with qualitative data where we interviewed shelter guests as well as implementing staff from the city, the county, and the various nonprofit providers, all to learn about this experience of transitioning from traditional shelters to hotels during COVID. And our top line finding is that common sense, staying in a hotel compared to a traditional congregate shelter offers a lot of benefits for health and well-being. And so I'll dive into this a little bit more, but that's kind of the overview. And I encourage you to check out our full report. I'll have those links at the end as well. So top line of the second study I'm focused on related to the effect of the COVID-19 pandemic on low-income tenant housing security. Working with this on Matt Fowle, an all-star PhD student at the Evans School, and in partnership with Violet Lavatai at the Tenants Union of Washington State as our community partner, funded in conjunction with PHI and the West Coast Poverty Center. And for this study, we drew from interviews. The Tenants Union has a hotline that is long existing where folks can call to answer questions and receive help about if they're concerned about eviction or other tenant issues. And so the interviews came from folks who had contacted the Tenants Union during the pandemic, about the first year of the pandemic. And then also we fielded a survey that yielded responses from folks who had contacted that hotline either during the pandemic or the year prior to the pandemic. And then we also accessed administrative data from their program records. The key top line clusters of findings here is that the pandemic exacerbated housing challenges for low-income tenants, and we also found an increase in prevalence of informal evictions, and also encourage you to check out that full report. So now I'm going to dive into each one a little bit and focus on how the pandemic compounded challenges for pre-existing in these populations and also offered some opportunities for innovation. So looking first at traditional congregate shelters, you can see these images of the main shelter, DESC's main shelter, the Morrison, and Catholic Community Services shelter in Soto. So this is what existed before the pandemic. And this quote from one of our hotel guests who had prior experience in a shelter I think is just so vivid. You was like 2 or 3 inches away from the next person. You roll over, they blow in your face, your ear. And I think for many of us who have had the privilege of housing security during this time, I mean, that is so horrifying during COVID to think about being so close to someone unmasked that they are blowing in your face and ear. So we've actually known for a long time that high density congregate shelters are particularly vulnerable to large outbreaks of infectious diseases. But before, they were primarily infectious diseases that didn't have so much of a risk of community spread. So we knew right away that these were a bad idea in a COVID era. In addition, some of these basic shelters, we have a range of what traditional shelters provide, but the very basic shelters provide only a safe place to sleep. And many of them use a nightly enrollment process, which means that you don't you have to leave in the morning and then you can check back in at night. And sometimes they'll reserve your bed, but either way, you don't have the autonomy to stay if you need to stay, if you need to quarantine, if you need to just be somewhere safe for a stay-at-home order. And many of those folks in the basic shelters did have access to a day shelter. But when we think about exposure and how much we all have been avoiding other people, this is not encouraged by this environment. Now, on the flip side, reducing density is also challenging because we know already that our emergency shelter system is oversubscribed. And so the only way to reduce density is to reduce capacity. So real challenges here. However, we saw this new policy innovation of hotels as emergency shelters. And so I'm sure many of you are familiar that immediately following the outbreak, King County, in partnership with Seattle, moved over 700 people out of shelters into hotels. And we've seen, that was just the initial numbers. We've seen more and more folks being able to access that intervention. Our study found that this de-intensification was associated with fewer clusters and outbreaks of COVID. So just from a COVID standpoint, safer to be in the hotels, but also these favorable health and well-being outcomes, such as increased feelings of stability, reduced interpersonal conflict, greater staff engagement, future focus on the future. And then we identified some of these very basic features, such as having your own bed and having your own bath and your door that you can close and lock, as being really important to what produced all of these favorable results. And so just a little bit of, I think, detail about this. We heard from staff, even before COVID, we've known that non-congregate is the best way to go. And this quote, "I don't think it can be overstated how stressful it is for people to experience homelessness. To be going through that and have the physical environment you're in be a place that is unpleasant and crowded and filled with people who are tense and angry and acted strangely only further intensifies the experience that somebody has. It's debilitating. It stops people from taking action to deal with their own situations." And from a shelter guest being in a hotel, it has helped to reestablish my self-esteem and dignity. So really seeing the impact, not just on COVID, but on other factors being in the hotel. So an exciting policy innovation to come out of that stress. Now, a little bit on thinking about low-income renters more generally. Housing precarity and its consequences have increased. So in our research, we heard from folks about income loss. We know that the COVID pandemic was brought on a lot of job loss and other reductions of economic opportunity, but we also heard about the health hazards of housing. So that even if you had permanent housing, if that housing wasn't safe, being there more during a stay-at-home order is not particularly welcome or helpful. So we heard about folks who had higher mold exposure or felt that they were in unsafe neighborhoods, and yet the risk of losing housing felt greater. It's risky to move. Folks didn't want to invite others into their house to help them move. There's fewer opportunities to double up. Maybe in another time you would go stay with family, but because of COVID, you felt that that was unsafe. You didn't want to put yourself at risk. You didn't want to put your friends or family at risk. We talked about the hazards of staying in emergency shelters. And then folks also had a hard time sometimes proving their income to potential new landlords, because they would get questions about, well, how do I know your job's still going to be there given COVID? We also learned about, or quantified, I think we all knew that renters of color were disproportionately likely to be housing insecure during the pandemic. And so this graph, just looking at, have you ever paid rent late rent before or during the pandemic, and we see that the increases of Black households were disproportionately more likely to be late on rent during the pandemic compared to before the pandemic. So a huge impact just on what this meant to be a renter, having that economic impact. But on the other hand, we also saw a huge new policy innovation with eviction moratoria. Eviction moratoria were not a tool that was used prior to this pandemic. They've been talked about and potentially used in very small ways, but here we saw wide-scale implementation, a federal eviction moratorium, and there were variation in levels and duration of protection, but roughly it's putting restrictions on saying a landlord cannot evict its tenants. Obviously a lot more nuance there, but the first time we've tried this. And our survey found that it was in fact successful at curtailing formal evictions. We would have expected an increase in evictions in this time, but instead we did not see an increase in formal evictions. However, our research also revealed that forced moves still happen and really highlighted that there was an increase in experience with informal evictions. So being told, and we see on this chart, some of the directives that folks needed to leave or being prevented from staying in their residence, even with the eviction moratorium in place. So understanding that formal eviction, the curtailing of formal eviction is positive, and yet folks were still being forced out when in many circumstances, creating all of those risks to leaving. So just finally looking ahead a bit at the policy impact, I think in the sphere of homelessness and housing during COVID, we've had greater recognition, widespread recognition of this connection between housing and health. We're also seeing potentially some lasting transformation of the emergency shelter system. King County is now underway in its Health Through Housing initiative, which is purchasing hotels for emergency shelter as well as permanent housing. There's other housing related policy innovations underway. We see this large scale rental assistance. Granted, it's having some challenges getting out to a lot of folks, but just the authorization of funding is at a scale that we haven't seen before. Just note that most of this is going to landlords, so it's not just for renters, but for the whole rental tenant system. We have a new right to counsel law that provides attorney representation in Washington state, and we may yet see the return of eviction moratoria for other crises. Now that it's a tool in the toolbox, I'll be looking to see if that's something that happens again. So I would just say the silver lining of the pandemic in terms of housing policy is seeing the political will to innovate and urgency to implement that I don't think we would have seen were it not for this circumstance. So I encourage you to check out the reports, and they both, all of the quotes and graphs and things are explained, as well as all your data questions. And thanks.
Okay, that was fantastic. Next speaker we have is Chelsea Rose, who is a research coordinator at the Department of Nutritional Sciences, and she's going to give a talk on food security and food access in Washington State during the COVID-19 pandemic.
Thanks, Peter. And also, I'm a research scientist now, not a research coordinator, but that's totally fine. Totally fine. Anyway, thank you for inviting me to speak on this panel. Oops, I have to share my screen, right? Let's do that. Are we good with the? Yep, okay, cool. So today I'm going to share some of the findings from our WA Food Survey. This is short for the Washington State Food Security Survey. We have done several waves of the survey since COVID began, and I'll get into the details of that a little bit more in a second. And the funding for the first wave was from the Population Health Initiative. The subsequent waves are also contributed to by the Balmer Group and the Paul Allen Family Foundation. And other UW folks that were involved in this were Dr. Adam Dranowski, who is the PI, and Jennifer Otten, who's the co-I. And we had other collaborators at WSU and Tacoma Community College as well. So the survey objectives for the WA Food Survey were to identify the impact of the pandemic on Washington state residents in terms of economic security and employment status, food access, food security, different dietary patterns, food shopping behaviors, and the use of different food and income assistance programs, including barriers and supports. And today, most of my talk will focus on the food security and food access findings, but we have briefs that go into all of these different findings in much more detail that I'll link to in the end. So like I said, the WA Food Survey was a collaboration between the University of Washington, WSU, and Tacoma Community College. There have been 3 waves of online surveys so far, the first of which was implemented in June and July of 2020, so the first pandemic summer. And that we got about 2,600 complete responses to that online survey. And then we ran a second wave in the winter of 2020 into the beginning of 2021, which got a sample of 3,500 completes. And then we just finished implementing our third wave of the study that was in July/August of this year. So some of those updated findings are going to be really hot off the press. I'm going to share with you in the talk today. And each of these surveys were convenience samples. So we're just kind of putting the survey invitation out there for anyone who wanted to, that was in a resident of Washington State above the age of 18 to take. And the recruitment was facilitated by state and local groups and anti-hunger organizations, as well as recruitment via social media. And that the social media recruitment started in the second half of the second wave, and also completely throughout the third wave as well. And these surveys are interesting because we can do both longitudinal and cross-sectional analyses based on the findings, because after every single wave, we at the end of the survey, we asked participants if they would be willing to be recontacted for future waves. And so for everyone who agreed to participate, we invited them to participate again. So we have a very large chunk of from each survey wave that has responded to more than one wave. And so the findings I'll present will be kind of a combination of looking at wave 1, wave 2, wave 3, all of them combined, or some of them, and I'll indicate that on each slide. So who responded to our surveys? So you can see that if looking at each survey wave compared to Washington state numbers, that we have slightly similar to the older age range compared to the Washington state numbers. And then we have the major thing here you see is that we have much less men as compared to the Washington state census numbers, which improved slightly in our wave 3 cohort. We have a slightly higher percentage of non-Hispanic white folks, except for in wave 3, which we had an increase in our Hispanic folks. And we have much higher percentage of folks with a bachelor's degree as compared to Washington state numbers, but we have a higher percentage of lower income folks. So this is going to be important to remember when we look at the rest of the findings from our study is kind of the sample breakdown and the demographics, because the survey from the get-go was designed to really kind of oversample the most vulnerable populations for hunger and food insecurity, so the lower income folks and populations of color and households with children. So just keep that in mind when we get to the findings. So where do the WAFOOD residents come from? So our respondents are, you can see from the darker counties have a higher response rate. So you can see from in waves 1 and 2, we have slightly more over-representation from Western Washington, but by waves 2 and 3, we did increase our representation from Central and Eastern Washington as well. And when you combine all 3 waves together, we have complete coverage from all 39 counties across Washington. So now I'm going to get into some of our findings. So you can see here, looking at it cross-sectionally, you can see that there was a pretty big jump in food insecurity by wave 3, and with 30% of folks reporting food insecurity at wave 1, a small dip at wave 2, and then an increase in wave 3. And this is just a reminder that USDA identifies a food secure household as a household that has enough healthy food for all household members to live a healthy, active life. So food insecurity would be a household that does not meet that definition. And we, in our surveys, used the USDA 6-item food insecurity scale for the first 2 waves, and by wave 3, we expanded to use the 18-item scale. And this is also kind of shocking to see how high the food insecurity rates are, above the previous Washington state average of about 10%. So if you remember, if you looking at the demographics before of the survey, we showed that we did have an oversampling of some of the more vulnerable populations. And it's important to consider that when you think about, if any of you have seen the recent USDA report that came out that talked about how food insecurity remained stable according to their estimates throughout COVID-19. So from 2019 to 2020, they showed that it stayed about at 10.5%. But they actually, when they dug into the data a little bit more, they showed that there was an increase by certain groups like households with children, non-Hispanic, Black, and Hispanic households. So these numbers aren't actually that far off from the nationwide USDA estimates, if you think of it in that regard. And if you look at our longitudinal cohort, you see that there is still a jump from wave 3, which was the summer of 2021 numbers, but it's just a little bit less severe if you just look at our longitudinal cohort. And you can see, if you break down the food insecurity by different demographics, there are critical disparities that persist across all 3 waves. And this here is kind of a summary of all wave 1, 2, and 3 data. So taking the people's most recent response. So that is a sample size of about 7,200 folks. And you can see, and if just remember that food insecurity is made up of very low and low food security. So the blue and yellow combined will be added up to equal food insecurity. So you can see here that the younger folks, people who said that they were non-binary or non-Hispanic, Black or Hispanic folks, and households with children and veterans all had higher food insecurity rates as compared to their other corresponding groups. And if you look at all 3 waves individually, you see these exact same demographic breakdowns. You also see that, unsurprisingly, people with less than a college degree, unemployed, and those with lower incomes also have higher rates of food insecurity. And we also looked at it by occupation, and you can see that the occupations that were hardest hit by the Washington state lockdowns, including, restaurant workers, so the food preparation services, so restaurant workers, and personal care services would be like, hairstylists or gym, attendants, and food sales, so like grocery store workers. So, and then transportation and food delivery, so the Uber drivers and Uber Eats and such, these groups all had much higher food insecurity than compared to other groups like the tech and education. But interestingly, you see here it's not zero among these certain occupations, that there is still levels of food insecurity across all occupations. And we looked at food insecurity rates by county. And again, here it's waves 1, 2, and 3 combined. And we only are presenting data here for counties that had at least 30 responses, or at least 10 responses that were food insecure. So some of grayed out counties, we just didn't have a big enough sample size to present the numbers here, but you can see that the darker counties are the ones that have higher food insecurity rates, and you can see that those are in more of the central and eastern Washington areas, which tend to be a little more rural or lower income. And looking at this another way by county, you go up, and sorry, some of the county names got cut off there. I think it was just a sizing issue. But you can see here that looking at the food insecurity by county this way, with median household income by the ACS, the American Community Service Survey estimates from the census, by our WAFood food insecurity prevalence on the y-axis, and the size of the bubbles just represents the survey sample size that we got for each county. You can see that food insecurity is prevalent across all counties, but you can see that certain counties had higher rates than others, and that it was kind of equally present across counties based on their average household income. And another important thing to think about when thinking about food insecurity is the assistance that these folks are getting. So there's clearly, we clearly demonstrated a need among these WAFood Washington State residents. So among everyone, so what does the food assistance use look like? And we can see here we surveyed folks about the food assistance that they were using before COVID and what they are using since COVID, and the striped lines represents what they were using before. And you can see that there was big increases across all 3 waves for all of the food assistance programs that we surveyed about, with big increases in SNAP use, in food bank use, and mobile food boxes and such. And we can see that food assistance use was also higher, unsurprisingly, among those who were reporting food insecurity. So you can see that SNAP use was green was before COVID, and blue was, green was WAFood 1 and blue is WAFood 2. I apologize. But so yeah, so you can see that that SNAP use was much, much higher among those who are food insecure as compared to those who are food insecure, for food secure. Similarly, food bank use was much, much higher among those who are food insecure as compared to those who are food secure. And I just wanted to give a little shout out to another PHI funded project that we did during COVID. And if we had had longer than 15 minutes or so to present, I would have definitely presented on both, but I'm going to give a little shout out here. So we did a WA tribal survey. So this came about after our first wave of the WA food survey, where there's some interest from the Northwest Epidemiology Center in the Portland area, where they focus on studying the American Indian and Alaska Native populations in Washington, Idaho, and Oregon. And we partnered with them to do a tailored survey amongst tribal populations in Washington state. And we had a smaller sample size than our WA food surveys, but we still were able to show that there was a very large food insecurity prevalence among the tribal populations that we surveyed in Washington, where 67% of the folks that we surveyed had some food insecurity. So that's very dramatic. And so just quickly to summarize the findings here, we showed that there was a really dramatic food insecurity rates, especially by different sociodemographic groups, including households of color, including lower income and lower education folks. And based on what we've seen from previous economic downturns, like the 2008 crash, we showed that the path to recovery can take years. So continued monitoring of these food assistance and food insecurity is definitely necessary, and there is a potential for the widening of these existing inequities to get even worse. So we have to really make sure we keep monitoring how this all unfolds and keep focusing on the most vulnerable populations. And like I said, we've got several different research briefs that dive into our data even more. We've got 11 so far and more to come. And you can visit the CPHN website to get access to all of those briefs. And here are contact me or our study email for more information. That's it.
Thanks, Chelsea. So for the people who are attending, if you want to ask questions to our panelists who just gave very great talks, please enter them into the Q&A. And then if you have specific questions targeted at a particular speaker, just make sure that you note that that question should be directed to them. But while everyone gathers their thoughts, you all mentioned the PHI COVID rapid response grants that sort of funded your research. And I was wondering if you guys could just quickly talk about getting these grants and what was involved with that, coming up with research topics, et cetera. So maybe we could start with Marissa.
Sure. So my cat is helping out here. So I had originally started working with bus drivers, and actually someone who works at the Seattle Times contacted me as a source for a story about exposures bus drivers were facing. And it kind of was a light bulb moment of, oh my gosh, we should be looking at these worker populations. And my colleagues, Nicole and Anne, were kind of thinking about the same thing with Uber drivers. And so that was kind of the spark where we're like, well, let's look at transit drivers and the effects during the pandemic. And so of course you need money rapidly. And that's kind of what PHI was able to provide, was they announce it, you get it, it's a short application, you get it in, quickly, and you get to start running. And so that's how we we were so grateful for that money to get us moving quickly on what we've been thinking about.
Yeah, I'll add for the hotel shelter study, everything was happening so fast, and it was like COVID is here and now shelters are a problem, and immediately, I mean, it was a real success story in terms of like public nonprofit collaboration and making work happen from the program side. And then we had been talking to, Greg and I had been talking to our partners at King County in the evaluation team. And it was right when PHI came out with the funding opportunity, and it all happened very quickly. And I remember even during most of our study, we were concerned that the hotel intervention was going to like end soon, because at that time we all thought like, oh, it's a month or two, right? Like this isn't something that's going to last. And so the value, I think, of being able to really get going quickly on a research program that was resourced and having that buy-in was really helpful. I would say, and same thing for both my projects, having the pre-existing relationships is really important. I think it would have been really hard to get these kind of projects off the ground if these conversations weren't already in play, just because the speed was so quick.
Yeah, and I think I agree, like the ability to move really fast was very important for us. And, the impetus for our survey is just that we definitely saw major problems with food access, among everyone, especially very early at the beginning of COVID. So we really wanted just to be able to monitor that and keep an eye on that and to see how that develops, and to be able to move quickly on that was great.
So we have a question from Nicole. So Professor File, will your research around tenant protections continue after the eviction moratorium is lifted? I imagine there's a lot of information we can get about tenant activity and short-term and long-term ramifications of tenant protections right now.
So a little bit of a, thanks for your question, Nicole, a little bit of a multi-pronged answer. This study is over. We are not an ongoing study for the the collaboration with the tenants union. I would say I'm not sure, Matt, if Matt Fowle has ambitions for us to do kind of some sort of second wave, but that's something that we haven't even talked about yet. So I'm not sure. I do have the privilege of working on looking at the outcomes of the right to counsel legislation that is just being implemented now. So that I'll have kind of a different perspective on what evictions look like in the state once that program is up and running. Right now, they're just standing up the getting lawyers, getting attorneys in each county for when, and some evictions have already started, but for really when things, the floodgates open maybe around evictions. So that will be a different perspective, just seeing, looking at the outcomes of eviction cases. But I agree, I think there's so much here, and we've seen so much sort of policy change that I think there's a real opportunity for a lot of interesting research right now that could potentially point to how we might scale up or adapt some of these interventions in non-pandemic times.
So Anne is thanking everyone for the presentations, of course, and she's asking, each of you faced specific sampling issues, and your talks illustrate a variety of sampling approaches. Do you have any suggestions regarding how to tackle sampling problems for studies that you want to launch quickly? So Rachel answered some of this, but if you guys could elaborate on your sampling designs during this for these rapid response grants and everything.
Sure, I can chime in for ours because this is actually a discussion we had very recently. So we had a convenience sample, right? So we kind of left the survey open to anyone in Washington State who was above 18 to enter. And we launched our survey on REDCap, if anyone's familiar with that program. And the addition of the social media recruitment was really kind of changed the landscape of our sampling quite a bit, in which we found out in wave 3 is you get, it opens the floodgates to a lot more of kind of seedy kind of bot behavior where you can get respondents that are not actual real respondents, but just computer generated responses that are fake data. So being able to kind of cast a really wide net and keep your survey open long enough to be able to kind of catch a wide net and then whittle down to the responses that you really know are your actual responses and not bot behavior. That is my advice. And that's what we'll definitely keep in mind moving forward. And so we did do a series of data cleanings and such, so we feel confident in the data that we have, but being able to keep it open up longer so you can get a bigger sample size that you can actually weed down and clean up afterwards is what my advice would be.
Yeah, just for us, kind of our sampling approach really depended on the union. And so by utilizing those community liaisons who are drivers who also liaise between other drivers and the union, that really helped ensure that our survey was culturally appropriate, it was accessible, and that there was trust between the person being surveyed and the surveyor. And that, they also were able to help a lot with making sure that our questions were appropriately worded, that the scales we were using were understandable. So was it the survey that we would have done if we did not have the input from them? No, not at all. But what, the final product we had, we felt really good about because we knew it would be accessible and appropriate for the population we were reaching. Of course, we were only talking to drivers who were unionized. So, we did miss out on drivers who are not, who may have had different experiences. So that's a limitation of our sample in general. But it also made the drivers accessible, which otherwise may not have been possible.
And just echoing Marissa, our partnerships were instrumental in both our credibility as researchers in this space and recruitment. So working with King County, who also had relationship with the providers, where we were talking to people who were in shelters, those were really helpful. And then in the tenant study, working with the Tenants Union of Washington and being able to say, you already reached out to them, we're doing this with them, made a big difference in terms, and we spent a long time thinking about how to construct the sample, what made sense for during pandemic, before pandemic, that kind of stuff. But we had the benefit of access to records that we were able to look at before we made those decisions.
So another question from Sabrina is targeted towards Chelsea. Has anyone considered the impact of not being able to use food stamps when grocery shopping online for those with mobility difficulties, immune compromised, lower wages, and shift workers? So just looking for other research.
Yes, this is using food stamps online is actually one of the things we actually asked about in our survey. And from what I believe is SNAP is able to be used online for grocery shopping, but yes, it may be harder for certain groups who maybe don't have access to the internet or something to be able to do that online. But yes, this is something that we surveyed folks about, and we asked folks about whether or not they knew they could use SNAP online, whether they have tried, and and whether they want to but can't. And so we have a lot more details about different barriers around that available in our research briefs that you can go and you can see. And we actually ask more details about different barriers about WIC, because I know WIC you cannot use to buy groceries online. So that's a big barrier for a lot of WIC participants. So yes, this is definitely something on our radar. And similar to Rachel and Marissa, our research group also relied on collaborating with different community leaders. Thomas Reynolds at Northwest Harvest was someone who we spoke with a lot in terms of formulating our questions to really get at the questions that these different stakeholders are really most interested in. And our SNAP contacts that we talked with did want us to ask about that. So that is on our radar.
Okay, so thank you to the panelists. You guys did a fantastic job, and thanks for answering everyone's questions. Join us next week when Ian Kennedy will be presenting on his research. And we'll see you next Friday.